So in Victoria, as part of the Inner South Community Health Service, we run a number of programs around for the sex working community, and that extends to illegal street-based sex workers through to brothel workers. Brothels in Victoria are legal, and we provide an outreach health promotion service to all of those brothels, and we in fact provide what we call a smiley face program, which sounds a bit kitsch, but it means that brothel owners who allow RED, our Resourcing Health and Education program, so RED, into their brothels, we give them a smiley face, which they proudly display on their doors, and it means that encourages other brothel owners to make sure we have access to their working men and women, so that we can meet with them and really talk about safe sex practices, pass on condoms, needle and syringes. So our work with sex workers is also part of a harm minimisation approach that is very, I suppose, common and one of the touchstones for community health practice and support in working in partnership with sex workers. So it's really about recognising that for many sex workers, certainly in the brothels, for some it is a real choice, and it is an active choice that they make, and it is quite a good way for them to make a living. They really look after their sexual and physical health care, and so it's a good choice for them. Of course, there are many, particularly street-based sex workers, for whom sex working is absolutely not a choice. Many are drug dependent, particularly heroin addicted, homeless, and extremely marginalised. So for them, it's a profession of last resort. So part of what we try and do in our program is to look at, again, working in partnership with sex workers, what is it that they want from us? How can we resource them to lead the lives that they want? So for many, they say, I would love to get out of street-based sex work. It is illegal. The police hassle them. The mugs, as we call them, the service users, are often extremely disparaging and not respectful to them, and they're often derided by the broader community. So they want that to change. So we lobbied government, and we got a program called Pathways to Exit. So that's for sex workers who want to leave, and that's again about starting with the things that they want. So it's about getting alternative qualifications. It's about getting some childcare that's ongoing and reliable. It's about improving their housing and making sure that's safe, so that they're able to then concentrate on things like training and employment that will enable them to have legitimate and secure pathways out of sex work.
Okay. Now this program, how I presume there were challenges when you were trying to implement this in the community.
Yes.
You mentioned a campaign you ran around NIMBY.
Yes.
So could you speak a little bit to the NIMBY campaign?
One of the dilemmas of the area in which we work is that the sex working community have been there for about 150 years. They predated most of the people who have subsequently moved in. It's quite a trendy area. It's by the sea, and so it has been gentrified over time significantly now, so that you've got housing prices. The minimum house is about $1.5 million through to about $5 million, which is not uncommon. And so many of the people who move into the area, and one of the attractions is its colour and its vibrancy, they then decide that really sex workers shouldn't be sex working right outside their front door, even though they knew that was happening before they moved in, and they therefore want to try and move the sex working community on. And so we've looked at a multitude of strategies to try and work in partnership with local community members to enable them to really understand the sex working community, and to try and to develop some shared solutions about how everyone can coexist. And so those solutions have been everything from fairly public campaigns about shared spaces, shared solutions, where it's largely been a media campaign to raise the awareness of the fact that sex workers have basic human rights. They have a right to live and work in their communities as well without being harassed. That in itself is not going to change community attitudes, and so we work closely with sex workers themselves so that they can tell us about what they think some of the solutions might be. We're hoping that legislative changes will in fact be part of the real solution, so the creation of safe sex houses and tolerance zones in which sex workers within the local area could keep working legitimately, not being picked up by the police, and therefore, but those areas then being quarantined away directly from some of the residential areas. So they'll still be very local. And then the creation of safe sex houses, so whether they're apartment blocks or a hotel complex where street-based sex workers can use a room for an hour, where there is security, where they can be safe, where they're not going to be bashed by the men who use their services primarily. And so that is what we believe will be some of the longer term solutions to having the community coexist together. But it's a long way from being realised. Our governments are very risk averse. They know there are no real votes in this or real political wins, so we're a long way from there.
Okay, all right, thank you very much.
Thanks, Kim.